I am Dr. Amy Williams. I am a nephrologist at Mayo Clinic in Rochester, and I'm also chair of the Department of Medicine in Rochester. I have a very active practice. I take care of patients when they are in the intensive care unit, through then their transition out of the intensive care unit into dialysis. I run a large dialysis unit on campus at Mayo Clinic in Rochester, Minnesota, where patients who have very complex medical issues dialyze, and it is a real honor to take care of them. They have to manage their very complex disease every day, and I'm glad that I'm there to hopefully help them manage that. Everybody's goal in this relationship is to have the best outcomes possible for the patient. And when I say that, it's not just living for a longer time, but it's being able to meet the patient's own personal and health goals. In order to do that, you really have to understand each other and bring as much knowledge into the decision making as possible. So as the provider, I bring the medical knowledge, the knowledge I've gained through my experience, all the big data. But as the patient and those that surround the patient, they bring the knowledge of their perspectives, their beliefs, their healthcare goals, their preferences, and very importantly, the most important things to them. And the most important things often may change during the trajectory of their disease. So the conversation can't be a one-time conversation. It's harder if it's a one-time conversation. It needs to be a conversation over time, especially for individuals with complex chronic disease, where the trajectory of their disease is not a straight line, but there are many loops, possibly in the hospital. For kidney failure patients, it would be getting a kidney transplant, then maybe transitioning back to dialysis if they lose that transplant. We need to be able to support these patients through every one of these transitions. And then you add to that the transitions that we all have in our lives as we go from one stage to the next. So it's complicated, and that's where trust, to allow honest, authentic sharing, is incredibly important. It is, I believe, up to the provider, whether it is a physician, a nurse, a social worker, NP, PA, to create a safe space, to have safe conversations, safe, honest, authentic conversations. And the best way to do that is to let the patient know that you are there for them. Your goals as a provider are their goals and what they want and what they need. And to listen, to listen, to listen, to listen. To ask clarifying questions. To be honest about your knowledge, what you're able to do for them, and what you need from them. Clarifying between the patient and the provider, the physician, what your different roles are in this relationship, what they can depend on me to be accountable for, and then what I need them to be accountable for. And that part of that is I need to be able to trust them. If they give me the wrong information, we're going to make the wrong decision together because I don't have the information I need to give them the data or the information that they can then translate to make a good decision. So it's so important to define each of our roles in order to have good outcomes. And you can't do, and that is actually part of creating that safe environment.